top doctors from across the country. Dr. Lavleena, if I can begin by asking you as a gynecologist, we've just heard from the women, so I want to begin by asking you, how important is it for women to be aware that, you know, a dreadful disease like cancer or any other can actually come knocking now much earlier?
Yes.
It's not like you have to be quote-unquote careful after you're 50 or 60. It can happen a lot earlier.
You are right, Rishika. We are seeing that cancer is striking at a lot younger age, and the cancers which happen at a younger age are more aggressive and they are fast growing. So it is very important that every woman should be aware of all these cancers. And breast cancer is the most common cancer in India. And as a gynecologist, I see cervical cancer, that is mouth of the uterus, that is the cervix, that is the second, and followed by ovarian cancers and other cancers. So as one of the survivors said, breast awareness is very important. And yes, self-breast examination goes a long way, you know, in knowing whether you are okay. One can look at the size and shape of the breast, look for any lumps, any thickening, any nipple discharge, or anything unusual. One should go to a doctor.
Right.
And the doctor should be doing a clinical breast examination to find any positive things.
Okay.
And of course, because it is striking at a younger age, so now the breast screening starts at 30 years.
Right.
And ultrasound is done.
At the very outset that you have to start early, etc., but anything specific?
Yes, for women it is very, very important for cervical cancer, because one of the causes of cervical cancer is human papillomavirus, which is sexually transmitted. And the good news is that it is preventable.
Right.
So we have, if a regular screening is very important, we have to do a pap smear in which we are taking cells from the cervix and we are looking for abnormal cells and human papillomavirus.
Okay.
And we have to do primary HPV testing every 5 years. If it is not available, it has to be combined with pap smear every 5 years. If that is not done, then every 3 years at least a pap smear should be done.
Right.
And now, since it is preventable, so we have a vaccine against human papillomavirus.
Yes.
So 9 to 15 years, all girls need to be vaccinated. There are 2 doses of HPV vaccination.
Right.
And after 15 years till 45, every woman should take 3 doses of HPV vaccine.
Okay.
So it is very, very,
Whatever
very important.
is preventable, and in this case there's a cervical cancer vaccine out there that Dr. Nader explained about, at least those need to be taken.